8, 9, 10.
That's good.
All right.
What I was
I wish I had done all stuff like the other eye doctor and all that back then.
You're gonna be the one to hold it.
Contacts are getting a little bit excited.
Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. Tonight we're joined by Dr. Junda Wu, who is our Bexar County Health Authority, as well as Dr. Ian Thompson, the CEO for Christus Santa Rosa. This is our COVID-19 update for the San Antonio community. Today we are reporting 1,078 new cases of COVID-19 in the community today, which brings our total to 34,633. Keep in mind, again, daily case totals are just one thing that we are tracking. You can review more information about where we are on positivity rate, hospital trends, and onset of illness, the EpiCurve, at covid19.sanantonio.gov. We unfortunately have a new high to report to you in terms of total fatalities today in one 24-hour period. This brings our total to 298. We have 15 new deaths to report. They are 7 Hispanic males in their 60s, 70s, and 80s, 5 Hispanic females in their 40s, 50s, 60s, and 70s, 2 white females in their 40s and 50s, and 1 white male in his 60s. We continue to mourn the loss of these members of our community. We are with their families and friends, and please keep them in your thoughts this evening. Over in our hospitals tonight, we're reporting another downward trend in terms of total hospital admissions. We're reporting 1,074 people in the hospital. That's down 39 from yesterday. We are up 8 in the ICUs to 437, and down 1 on ventilators to 287. In terms of capacity, 46% of ventilators are available and 12% of staffed hospital beds are available, and the hospital system overall remains under severe stress. Those of you who are tracking the total proportion of COVID-19 in our hospitals overall, that is now at 32% of all patients in the hospital attributed to COVID-19. Turn it over now to Bexar County Judge Nelson Wolff.
Thanks, Mayor. At least the numbers are looking good in terms of people in the hospital. One of our high point was 1,267, so we're down about 193, but that could change any day. But the really scary part is how many people we still have on ICU and on ventilators. It's continuing to be a challenge for us, so we all need to do everything we can to be careful. I must say we're starting to run in trouble at the jail. Our population has exploded from 2,900 up to 3,665. Of those, about 390 are paper ready for the state prison system. But the fact of the matter that the state is picking up very, very few people. At the same time, the state's not picking up on it. Only 1/3 of people that we did get out on PR bonds now, we're only doing 1/3 of it because the governor's order and because some of the mags are being a little bit more restrictive. So what's happening to us with 47 guards out, 27 civilians out due to COVID, we are running out of room in the jail to separate them. As you know, we got a very good system, testing where they come in, put them in a separate place, keeping the distance that we need to keep, but now going that much higher in population, we're beginning to see some problems. As you may recall, early on when we had a population that was very high, we had about 295 cases, but we worked hard, did the testing, and bring it down. And by June the 12th, we only had 20, and it stayed low for a very, very long time. Now it's trending back up. We had 100 the other day. We had 83 yesterday. So we're going to really have to have some help from the state and have to have some help from our judges and trying to still comply with the governor's order, which made it very, very, very difficult. But we're starting to see the trends going in the wrong way for our jail. We were just talking earlier, Dr. Wu and all of us, about the issue of testing and how long issue of testing. That's one thing, you know, that's fairly easy to do. What's been hard for us is to get the results back from labs. I believe with the testing we're doing and the labs we're using, we're getting average about 3 days. But there's others that are taking 7 to 10 days, and that is showing up all across the United States. I'll give you an example. When you look at the big numbers nationwide, there were 100,000 people being tested in March. Now we're up to 700,000, and these labs are getting about 30,000 every day to do the test. So that is getting backed up in in a tremendously bad way. We mentioned to you where we are on hospitals. It's a trouble all across the nation. There's over 59,000 people in the hospital today because of COVID, of which 10,800 are right here in the state of Texas, and we're getting about 66,000 new virus cases a day across the nation. So we are still got a long way to go to solve this. We don't have borders around San Antonio, Texas, or Bexar County. People come in, people go out, and so we're affected by whatever else is happening in the nation. So it's been a real challenge for us. While there's some evidence we may be headed in the right way, we still have a long way to go. So like the mayor says, please do what we're asking you to do: the mask, social distance, sanitation, stay away from large crowds. We still got a ways to go to get out of this.
We do, and it's no time to let your guard down. And I will remind you that as we bring you these numbers, these are family, friends, loved ones, neighbors, aunts, uncles, people who we've lost in our community. And we have seen, as the cases have gone up, the severity of cases in the hospital has also. And we are tracking now the mortality of these cases, particularly in ICU, as well as on ventilators. And 1 in 4 of cases who are admitted to the ICU are now deceased in San Antonio. And 40%, more than 40% of those on ventilators have been are now deceased. So we want to do everything we can to protect our community. Please do your part. Wear a mask. And if you have recovered from COVID-19, we encourage you to consider donating plasma. You can find out if you are eligible to donate plasma by contacting the South Texas Blood and Tissue Center. You can go to southtexasblood.org. Again, wear your mask, stay home as much as possible, and we can get through this together. As always, you can text COSA-GOV to 55000 and get the latest updates on COVID-19, or you can go to the website at covid19.sanantonio.gov. Dr. Thompson, Dr. Wu, myself, and the judge are available for questions.
Dr. Wu, can you give us an update on the situation with testing? Is that available to anyone who wants to be tested, or is it just for people who have symptoms?
The free sites are just for people who have symptoms, but of course people can go to medical providers and they're able to get tested if they don't as well.
Okay. And also I wanted to ask you about the updates on the active cases versus the recovered on the dashboard, because it seems like there's a lot of numbers that have moved from active to recovered in the last week. And I know that those are just estimates. Can you tell me if there's a trend of where you're realizing that a lot of people have recovered?
So usually there's a mathematical formula that's used by the state that we also use, and it depends on whether they had mild illness or whether they were hospitalized and had more severe illness. But most people who don't get very sick, they'd be recovered at 14 days. So part of what you're seeing is a reflection of when these people started to get symptoms or started or had their first test.
Dr. Wu, is it safe to say that we're not seeing enough people are answering from contact tracers once they get that call? What are we seeing here? Why is there a delay?
About half the time, people don't answer the phone. And what we've tried to do to fix that, starting earlier this month, is we put it, when we call you, it says SA Metro Health Department. So please, if you get that call, we're trying to stop this infection, and so please answer.
Dr. Wu, we have some text questions from Emily Balkin with News 4 regarding nursing home. Can you discuss the situation at the landing at Stone Oak?
Yes, that's. I didn't know that you were going to say more, but that's an assisted living. They have reported to us having 15 infected residents and 7 staffers. They have also had 3 deaths. HHSC is, of course, on site, as they are whenever there's an outbreak. And we've been providing them some coaching, and we'll be visiting and helping in other ways as well, helping them get tests processed more quickly, that kind of thing.
It's HHSC, a state agency, and do they have jurisdiction over this nursing home, not the city?
Yes, so the regulator is HHSC, the Texas Health and Human Services Commission, and they regulate nursing homes, assisted livings, the licensed ones, as well as group homes, adult daycares, that kind of thing.
Does the city consider this an outbreak, and what is being done to contain it if you do?
There is a CDC and state definition of an outbreak, and it's one positive in a nursing facility or assisted living. So that's one positive staffer, one positive resident. So this is an outbreak, and we do the things that we always do. One of them is encouraging testing. The CDC recommends once a week so that you can catch those people who don't have symptoms but might be positive. But then we run into that problem that the judge was talking about, that if it takes you a week to get results or more than a week, then that's not very helpful. So we do help as much as we can by also using Metro Health lab resources.
Curious to know about our hospitals right now, Dr. Thompson. How many of our patients that are in the ICU what is the age range looking like right now, and how quickly are these symptoms also progressing?
So the age range of the folks in the hospitals runs a large gamut. We have folks in the 40s and folks in their 80s and 90s, and the outcomes are, as has been discussed at these meetings before, the outcomes of these folks are really dependent upon their existing health as well as their age, their ability to respond to a COVID infection. And your other question was?
How quickly are these symptoms also progressing for those that are in the ICU?
So in general, the path for someone to reach an ICU is either a fairly rapid progression of symptoms at home that brings them directly to the ICU, or they may have visited an emergency room and been okay to go home and progressed quickly and got worse. So that's what gets them into the ICU. The other way that folks can make their way to an ICU is an admission for an infection that is not severe enough to be in an ICU. They may be on oxygen and receiving supportive care, and then oftentimes we see at the 3, 4 to 7 day period that they will progress, decompensate, and that way they make their way to the ICU. So to get to the ICU, you have to be pretty sick to begin with, and then all of the focus on supportive care begins. And so then it becomes a bit of a waiting game. All the treatments that begin at that point to try to enable that person to recover, oftentimes the length of stay can be quite a long period of time. You'll see people in the ICU for sometimes 60 and 70 days. So it's a very variable course, but by the time you get to the ICU, you're pretty sick at that point.
I'd like to just pivot back also to the nursing homes and assisted living facilities. As in regards to the testing, Dr. Wu, how are we doing the testing? Is it no longer once a week in these nursing homes?
No, it's as close as possible to once a week. There are nursing facilities that are using their private labs and getting back results in just days. And there are others where it's taking longer, and it really depends on what your contracted lab has available.
I'd like to also know how quickly are they reporting positive results back to Metro Health, and also how quickly are they reporting deaths back to you guys as well?
They reported, again, I don't have, on average, pretty quickly. And the deaths sometimes take longer to show up. You may have heard me talking to the mayor about this just before we went live, because if they call and tell us as soon as they're available, as soon as they're aware of a death, that's before a death certificate's even been signed by the physician, and then it's gone through all the other processes, through the medical examiner's office, through our epidemiology office to verify that it's not something that we've reported elsewhere. So there's a delay between when we know about it and when it shows up counted.
We have some questions from Brian Kirkpatrick at Texas Public Radio for the mayor and the judge. What do you think about the curfew and shelter-at-home orders issued in Hidalgo County, and are we near those sorts of actions?
It's very difficult to have an order in place that you can't enforce. And so it's been a challenge to deal with the back and forth of state orders. What we have consistently told our state officials is that we need to be much more judicious and thoughtful as we open up Texas, and I've said repeatedly we've opened up too fast and too soon. That said, what we have advocated for recently is more local authority to roll back in certain areas. We have talked about the vast array of exceptions that are in mass gatherings right now. And one of the key areas where we're seeing transmission, and one of the first areas that we put it into, was mass gatherings, particularly indoors. We also have talked about the fact that youth sports, recreational sports particularly, that are unregulated, are very problematic right now. And so we need a little bit more thoughtful way of handling and regulating some of these gatherings that are accepted in the state order.
Well, I think it's a mistake to put in place an order that has no force of law. The governor's made it clear that he's not shutting down Texas, and the action that's taken in Brownsville, I believe it was, is in contradiction to that. And even the judge there notices that it doesn't have, it can't be enforced. So I think it's a false thing to say something and you can't work to make sure it gets done. I think the mayor is right on these mass gatherings. I mean, everything we know and that we've learned as we come along, the greatest hazards in mass gatherings. And we've mentioned it, I think, 2 times already, that if you're in a group with 100 people, it's almost certain that someone there will have COVID, 99%, group of 10, 37%. So we know that's where the danger part is. And as the mayor said, we have a limit of 10. But there were 13 exceptions, and if anything was to change, and the governor was to even make any modifications, that's certainly where he should make them.
Another one for the mayor and the judge from TPR. Are San Antonio and Bexar County ready to handle the virus plus severe weather such as hurricane?
So let's start with the fact that every city in Texas is struggling in roughly the same point we are. If I had to choose any city to be in with regard to handling multiple challenges and disasters like this, there's no better place to be than San Antonio. We are going through tabletop exercises right now with our emergency operations to ensure that we're able to handle multiple complex disasters and emergencies just like this. But I will tell you, it's a huge challenge if we don't see these infections come under control. We're trying to physically distance people, and that's that's a antithesis to what you see during an evacuation. So we need to do our part as we get into the heart of hurricane season to make sure that we don't see a severe problem with infections. We need to do our part right now as we're not having severe weather to bring the transmission under control.
Well, you know, we're the emergency center for South Texas, particularly with respect to hurricanes, and as you know, they've even got signs up where to go down the highway coming from Corpus Christi, and all the roads lead to San Antonio, and we've always handled that out at the Coliseum. We've been very well organized on it. Nim Kidd, who's in charge of the state with respect to having people out there, but as the mayor said, what complicates that, yeah, you can handle it, you can get them there, but if COVID's still spreading and we're not able to separate people as well as we would, that could have a huge negative impact on San Antonio with that many people coming here. And we also know that the outbreak in Corpus Christi is probably worse than any other place in the nation. So it will be a big problem.
One more from TPR from Metro Health. Could you please respond to the pushback from suburban school districts located partly in Bexar County that say their parents want kids in school from the start of the school year? Both Bernie and Comal ISD say they disagree with the order closing their Bexar County schools and want to be exempt from the order.
We had a call about this today. with the TEA, and we're talking about additional guidance that the TEA might be able to issue.
Clearly, the lack of uniformity in school openings in terms of guidance from the state has complicated this issue at the local level, especially when you have suburban districts and 17 districts in the same area. So we're seeking clarification from the state on that issue.
Just had a quick question about the hospitals. Out of the percentage of patients that we have in the hospitals right now, how many are from outside Bexar County, and are we assisting any other communities in any way during their...
The estimates are around 20 to 25%. I believe Eric said today 146
And outside.
Yeah, in the
outlying
region
counties.
out there that are coming in here, but it runs anywhere from 20 to 25%. And we're seeing some outbreaks out in the region too, and there was concern raised today that they may be reaching their limit and being able to handle it back in their own community. And so 20, 25%, if you got 1,000 people in the hospital, you got maybe 200 or so from outside of Bexar County.
And are any of these, Judge, coming from the Rio Grande Valley, as that's also been a problem area?
Well,
There aren't very many coming from the Rio
Yeah.
Grande Valley. Corpus to Laredo up to Eagle Pass and so forth are generally where we see them from. But we're also sending some of our staff to those hospitals to help them.
That's good.
So that they can treat in place and may help maintain some of the capacity here in San Antonio.
That's really important to do.
We have a question from Henry Ramos with Ken's 5 for Judge Wolff. Could you give us an update on the sheriff being more aggressive citing businesses that aren't following the county order?
Well, I don't have an update on how many citations he's issued yet. I'll get it for you, but I don't have it tonight. I don't know whether you got any on the police department.
Well, last check, we've issued over 100 citations for folks, and I think, I don't remember the breakdown of mask order versus everything else. I think a quarter of them were just on the mask order, and then the rest were of other violations, occupancy limits, that sort of thing.
Question from Lauren Karuba with the Express News. Do we have a sense, based on the high number of case totals that San Antonio has been posting, whether hospitalizations are likely to go back up soon? Do we have any idea why they've leveled out recently?
Well, I think if you look at the models that we've seen since this all began, the models take the very best data and predict what's going to happen, but the one piece that the models cannot model properly is behavior of people. And so these briefings from the mayor and the judge and from Dr. Wu and others giving guidance probably is changing some behavior, seeing the numbers, hearing of people that people know that have become ill and unfortunately may have passed, maybe changing behavior as well. I'd like to think that that kind of activity is what's the reason why it's going down. What it's going to do over time is going to depend on whether people listen to the judge and listen to the mayor and take all those very simple steps to prevent this from going back up again.
From J.J. Velasquez at the Rivard Report, is the ICU ventilator mortality rate we are seeing here in line with what you see around the country with COVID?
Yeah,
I think the
so.
short answer is
Yeah.
yes.
Thank you.
All right, thanks, everybody.
Thank you.